President for Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Welcome back, Courtland.
Thank you.
Nice to see you.
You too.
Big news last week, the judge in Florida, federal judge, ruled that the mask mandate the CDC implemented is not valid any longer.
Mm-hmm.
And curious what you think about that?
You're talking about with travel?
Travel
yeah.
Mask mandate.
Yeah, I was in the airport this weekend and on a plane, and it was a little uncomfortable being with 300 people in an enclosed area with no masks on. I had my mask on. Actually, probably 20% of folks still had masks on. So, I mean, we know that the masks work really well. So, and we've sort of seen the uptick of cases around the world so it's hard to keep track of which variant is which now, but the BA.2 variant is Omicron, and that's the one that really fueled the worst peak that we had in sort of mid-January of this year. And there's now like sublineages of Omicron. BA.2 is one of them. There's BA.2, there's BA.2.12 and 2.12.1, and there's all these little children of Omicron basically. So we're seeing those circulate in different parts of the world. Shanghai's got a pretty significant outbreak right now. Beijing does as well. And we're seeing cities on the East Coast here too. So it's definitely not gone. I mean, it's definitely something we have to still deal with.
So we're seeing different things, different response to the pandemic in other parts of the world, like China. You mentioned that they've, some cities are in complete lockdown again.
Yeah.
You got to wonder, is this in our future too?
Yeah, I don't see that happening here. I mean, it's much different. I mean, now we're sort of seeing, I think, differences between how governments deal with this in their respective countries, and I think culturally things are very different. In a lot of South Asian countries, mask wearing in the winter is very common already. So I think it's culturally much more acceptable to do that. Here it's a much heavier lift. People aren't as used to it. I think we'll see it more here, though. I think we'll start to see people here more now in months when flu and COVID are spreading, wearing masks voluntarily.
Yeah, obviously, a communist country, there's a bit more of a hammer that the government has over the population.
Right. Yeah, that's right.
So they do what they're told.
That's right. Yeah, they don't have a lot of choice. Yeah.
You don't want to stay in your apartment for 2 weeks? Then we've got another apartment for you downtown for 2 years. So we've also seen cases rising in Europe, and in the past, when we've seen that rise in Europe, it happens over here. We're about 4 to 8 weeks behind
it seems
Europe.
to be the case that things have trended to peak a little faster there, and then we seem to follow. But so we're not quite there yet. And it's hard to say because there's so many new variants now. It's really hard to know where one peaks and one originates at certain times. I think what is probably going to drive it more so is now we're going to see that the natural immunity that people had from being infected in December and January is starting to wane. We know that's about a 4 to 6 month cycle. So you sort of couple that waning natural immunity with the rolling back of these kind of public health measures. So I think it's expected that we'll see things start to take up. We've seen that here locally. We hit our low in cases here about 3 weeks ago, and since then we've started to see a little bit of a trend upwards as well. So there was one day where we had, I think we did actually hit 0 in the hospital at one point. We're back up to about 13. There's 2 in the ICU. So it's still there, and it's still making people sick.
So that would have been the first time in over 2 years where there was no COVID.
Yes. Yeah.
Wow.
Yeah, I should have made a note of that when that was, but it was a few weeks ago where I think it was only for like a couple hours. We'd sort of gotten everybody out, and there was a short celebration, and then we're back to where we were. But it's been pretty consistent, even at the times where the cases have been at their best in the last 2 years. There's always 10 to 20 people in the hospital. It's pretty consistent. And you think about that, I mean, that remains fairly significant, right? I mean, at any given time, a hospital, Jackson Hospital is just under 300 staffed beds. So when you've got, 10 to 20 people in the hospital, 5 to upwards of 10% of your hospital beds that are taken up with COVID that we're not using for something else. So at the best time.
Yeah, well, the CDC today said that now COVID is the third leading cause of death in the U.S., so it would stand to reason that you're going to have a lot of people in the hospital with COVID.
That's exactly right.
Statewide, we're seeing hospitalizations down.
Mm-hmm.
We're seeing severity, though, of those hospitalized. Is that down as well?
It has been. It has been with Omicron in general. So the thing with Omicron is that it was significantly more transmissible, very easy to spread between people, one of the most easily spread diseases ever. Fortunately, there was this trade-off where we got less severity but more transmissibility. So more people were getting it, but they weren't getting as sick. Now, in terms of demand on the hospital, it's pretty much the same because you had so many more people get it, even though it was less severe, the same numbers of people in an absolute sort of fashion were still going and needing hospitalization. What's a little concerning is there's preliminary data now on these subvariants of Omicron that seem like they're making people sicker than we sort of initially thought. So it seems like we have something that's very easy to transmit, and it makes people a little sicker, more severe than we were thinking. And that's kind of the worst case scenario, is you'd have something that makes people very sick and is very easy to spread. Maybe not as bad as Delta, which seems like has been the worst variant so far in terms of how sick it made people. But there's, I've heard in media and I've heard in different places that this is some sort of natural evolution of a pandemic, that things become easier to spread but like less severe over time, and then it tends to fade away. That's completely untrue.
Oh, really?
There's no reason why that would be the case. The viruses are mutating randomly, and so there's selective pressure for them to become easier to transmit. But that doesn't mean that they wouldn't make people more sick. There's just not really a good reason why that would be the case. So the sort of experts, infectious disease specialists that I think look at this, there isn't really good historical precedent that would say that a pandemic is going to get less severe over time. It could mutate and get more severe again. There's no reason to say that's not the case.
Well, I've heard people explain that it's like it gets watered down over time. That's not the case.
Not the case. Yeah, it's not the case.
How do we know which virus we have? All these variants. How does anyone know? Because in many cases we're doing home tests and we're not reporting it to any authority.
Yeah. So so we don't always know the numbers now because of the home testing and how ubiquitous it is. So, and that can be okay, right? We want people to get tested and know what they want to do and know that they have it, because then it's important for them to isolate and not expose other people to it. So the home testing is really good for that purpose. But the sequencing that you need to determine which variant you have is a pretty lengthy process. And so there's not really a reason to sequence every single version somebody has. What they do actually is, at the state level, we sort of sample from different parts of the state to see. It's sort of a statistics game. And so you look to see, out of the sample, what percentage of them are a different variant. And then you tailor the treatments to the different variants that are the most common. So the monoclonal antibody was the most effective, for the longest time, most effective treatment option we had. And we iterated through different types of monoclonal antibodies based on how resistant the new variants were to the old ones. And we were changing, literally we would say, there were times at Henry Ford we said, okay, Friday's the last day we're going to use this type of monoclonal antibody. We're switching everything to this other one starting tomorrow. Because now the proportion of the new variant is high enough, and we know that the old antibody is not effective, so we're going to switch. So that's where it's really helpful. Knowing on an individual basis from a treatment standpoint isn't really necessary. Because
the antibody treatment is actually from the blood products of people with the virus at
well, that initially, early on, there was that. They used convalescent plasmas. They took the plasma from people who had gotten better. Now the treatments they're manufactured. So these are drugs, these are pharmaceuticals that companies make. It's really amazing that this stuff is possible. I mean, these are lab-created sequences of proteins that are antibodies that can recognize the COVID virus. And that is what we infuse. And so it helps tag it for your immune system so that your immune system can clear the virus.
So those home tests, I've taken one. I think everyone's had at one point or another. Look at the box, made in China. You know, it's not comforting to see that. Is this real? You know, and I guess we're hearing so many people, false positive, false negatives. The reliability of the home test is in question.
I think, so the home tests, that's a really good question, and I think a really good point to make is that so the PCR test that is the gold standard test. Like, if you really need to know if you have it, you have to get a PCR test. The home tests are very good if you have symptoms. So if you've got a runny nose or a sore throat or you're feeling fatigued, whatever, the home tests are great. It's very good at identifying true disease that's there, or being negative, ruling out if it's not there. They are not good at all at testing asymptomatic people.
Really?
And they are used this way incorrectly all the time. You know, I'll have people that say, well, we all tested and then we did X, Y, and Z, right? That is, it is virtually pointless to use a home test for that purpose. They're about 30% sensitive, the best ones, 30% sensitive when you do not have symptoms. So that means that they're going to miss 70% of cases. So in which case, you know, what's the value of the test? It's not really very valuable.
Well, it's even more dangerous if someone takes the test in the morning, it turns out they read it as being negative, and then
That's
just
right.
live, breathe, and
That's right.
You know, spew
And
all
there's really not a good replacement for all of the public health measures. These are all tools, right? Like, nothing is the answer into itself, right? So the vaccinations are very effective, masking is very effective, and then testing is another strategy we have. So you have to use all these things together, and to rely on like one or the other isn't really the complete picture.
All right, let's talk about the vaccines, because now we're in the second round of the booster, and I had mine on Friday.
Nice.
And just sore from the shot, and that's it. And no side effects.
Still here. It's good news.
Here.
Yeah, outstanding.
I'm still standing. I was able to come to work today.
Yeah.
50, and I'm in the 50 plus category, which is a recent.
That was, I believe, Thursday last week, where the CDC dropped. It was 65 and over, and then they dropped it to 50 and over. So that's brand new. Just last week. So the only populations now that can't get the second booster is basically under 50. That 12 to 50 age group can get boosted. They just can't get the second booster yet. And then the youngest age group, where it's authorized, the 5 to 11 or 5 to under 12, they can get the primary series, but they're not eligible for a booster. And this kind of follows as the data comes in over time. It takes more time to look at that and then determine, how many doses people should be getting.
Well, that's the thing about the airplane, because quite a few people can't get the booster or can't even get an initial vaccination series, the 5 and under. And when they're traveling, they're susceptible.
That's right.
So the recommendation for those families, here we are, travel season.
Yeah, there's still a lot of, so I feel much more comfortable now traveling or doing anything than I did, 2 years ago. And it's because we have vaccines, we have monoclonal antibodies, we have oral medications now. So we have a lot of things we can use to treat it. But there definitely still is a group. There was, I think it was basically January and half of February, there was about 400 pediatric hospitalizations for COVID throughout the country. I mean, this is the younger groups, like the 12 and under, or under 12, I think it was. So it's statistically, those are very small numbers, but if it's you or it's your family or your kid, then you don't want to be in the hospital with COVID. So it's significant for you.
So as a society, it seems like we've all decided that, okay, this is going to be with us for a long time. If there's no end in sight, we're going to just function with it. We'll make adjustments as we can, but we're not going to stop living our lives.
Yeah, I think people are definitely adjusting. I think it's absolutely the case. I think the best we can, I don't think it's realistic anymore in this country or even anywhere really to completely shut down the economy to deal with this. Not when we have these other measures in place that we can use, right? We know the vaccines work, we know the medications and the antibodies work. So we have tools, which is great. But we do, people still need to be aware and kind of use common sense. If you have symptoms, don't go. It's fun, even at work, right? Even at the hospital, people will come in and I should have a runny nose. I'm like, get out of here, because that's just how we've been. I think culturally, like, well, I need to go to work. I'm gonna tough it out. It's like absolutely not. Like, you need to go home. You need to get tested, and the symptoms can be so mild at this point for some people that, especially who've had it multiple times. And there's people who have had it like 3 times now. I mean, it's like. Immunity wears off, they get it again, and and those folks, they may just have a runny nose and not really realize that this is COVID again. And so it's really important for folks to be aware of their symptoms and get tested. Home test, PCR, I don't care, you get a test, because that's going to help you from exposing other people.
Well, that is a good point. We are, I think, maybe more sensitive about our how our health affects people around us.
Yeah,
and
absolutely. Yeah,
tough it out, go to work. Not anymore.
Not anymore. No, not anymore. People have so many PTO days and they're trying to figure out, and it's like you got symptoms, you really got to stay home, because the consequences for certain folks if they get this are still very serious. So it's really, you got to be aware because the other people, even if you don't care, about your own outcome.
Oh, I know, and we all know people that have the spread guilt where they've.
Absolutely, yeah. Absolutely.
I don't want that.
No, and that's one of the things. I mean, so I wear a mask all the time in clinic, and patients come in and they're like, "Why do we still got to do this?" Right? And part of it is, one is if we get sick, we can't see all these patients, so that's no good. So, and then the other is we're seeing all these people, so we're constantly being exposed. So it's better for the patients that we're masked because of all the folks that we're seeing, right? So it goes both ways, and it's an easy thing for us to do. It's not disruptive for us.
Today's the start of National Infant Immunization Week, and I think the concern among health professionals is that we've fallen behind during the pandemic on things like kids' immunizations.
Yeah, we have. Yeah, the numbers on that are pretty staggering, because those kids come into the pediatrician's office. That's where they get the normal, series of shots for, things like hepatitis and, pertussis and tetanus and things like that. And, the visits to doctors' offices went down. And so when visits to doctors' offices go down, we fall behind on those normal well visits that we have for those pediatric age groups. So that's a big push, is to get people back in to get back on the schedule and back on track with those things, especially as people are going back to school, right? Because that's where those diseases tend to spread.
Well, we've had this one-track mind, with as far as public health with COVID. So we're seeing cases increase in hepatitis, STDs, there are other public health issues to worry about.
Yep. Yeah, these are things that are sort of, I think, simmering in the background that most of us don't really think about. So normally when the public health system is working well, you don't really know that it's there. And so things like this, vaccine preventable illnesses, especially in children, sexually transmitted infections, tuberculosis. I mean, there's other things public health does, just sort of in the background. And I used to do that. I was the county medical director here in Jackson for several years before I started this current position. And so there's folks at the health department, and this is what they do. They keep track of these things, and then that all got put on hold basically as soon as you have a pandemic.
And there are a lot. There's more than a dozen vaccine preventable diseases.
Oh yeah.
So get vaccinated. The booster, I'm curious. I've heard different, including doctors, say the length of efficacy of the second booster is not as long as the original vaccine or the first booster. Can that be so?
So the reason for that is the changing of the virus. Mm-hmm. So as we've developed different variants that are easier to spread, the immunity that the body gets from the vaccine isn't as capable as preventing infection. It's still very capable of preventing people from getting the severe illness that causes the hospitalization and the death. But it's the changing variants that is, the vaccine has been a constant, right? It's the variants have been changing, and they haven't changed enough where it's really warranted production of a different type of vaccine. But this is something we do every year with the flu, right? I mean, there's dozens of circulating strains of influenza every year, and so and there are dominant ones, but the flu vaccine has to be tailored to try and cover what the most likely strains are that are going to be circulating. That's likely to be very similar with COVID, is that right now we have a vaccine that's covering many variants, but that may not be the case in the future.
All right, so right now in the hospital, you had a good day last week, 1 period, 2 hours, no COVID, but it's still there. I mean, we've got, last week the health department reported we had 1 death last week from COVID, so people are still dying.
Mm-hmm.
People can still be really sick.
They are, yeah. At our worst time period, which was basically November, December, January, February, November, December, January, 2 people died on average every day of COVID. When that was only like 4 months ago, right? That was very recently.
Yeah.
And then it trickled off a little bit, and now it's intermittently. Yeah, somebody's dying once a week or once every 2 weeks, but it's still happening pretty consistently here that we're losing life from this.
All right. Well, we appreciate all the updates, and again, all the people, all the healthcare angels still working hard. It continues to be a strain.
Everybody's still at work.
And everybody's still, you're beat up. Really, it's the health system is beat up.
It's been a long 2 years. So this little window we're getting here right now is something folks have really been appreciating. It's been a long stretch for people.
Appreciate your time. Thanks for coming in.
Yeah, thank you.
Good to see you, Dr. Courtland Keteyian, Vice President of Population Health with Henry Ford Jackson Hospital. Up next.